Good evening, folks. Tonight I'm going this episode. I'm going to do another editorial on this whole coronavirus thing. Those of you who don't like those, you can move on. Those of you who are going to just troll me later about how what was it? Somebody said it was leftist rhetoric. See you later. But there's some serious stuff going on, and I just have to say something. And I think it's important. I don't think a lot of people are really paying much attention. It's not like we all have too much to do. I mean, right now we're just now starting to people. I guess we're just now starting to get out there doing stuff, which is unfortunate. But up until now, there's been no excuse not to pay attention to what's been going on in the news. And I've been watching the uncut, unedited versions of what's been said by Trump and everything, the governors and the scientists and the doctors and all of that stuff. And this is a big problem, people. I mean, I told you in the last editorial I did on whether it was an evil agenda by Trump or is he a moron, that I've been paying attention to this coronavirus thing since at least the beginning of January. At the time I started watching, there were only 2,000 infected in China, if that gives you some idea of how long I've been watching this thing. And I knew this was going to happen. When I started seeing that number was literally doubling every day. That's a problem, and I knew there's no way you're going to, I was picking people up at the airport that were from China here in Huntsville, Alabama, because we have the rocket center here. Rocket scientists come in here all the time from all over the world. So I knew it was obviously coming in the United States. And I was just, thankful that I didn't happen to pick one of those people up. So tonight I want to cover a few things, about this whole reopening and all that stuff. My opinion is that this is way too soon. My own father is one of these people who staunchly supports Trump. I mean, to the point, it almost got the fists being thrown between me and him one day. And I didn't even really say much, but that's just how, crazy he is about this whole stuff. And he really doesn't know what he's talking about. And I think that gives me a very good idea of why these people who support Trump so staunchly do so, because they're not really following what's going on. They're only listening to Trump, and that's why Trump does what he does. He tries to control the narrative. He knows that by and large, the people are only listening to him and Fox News, who support him. And everybody else is fake news, so they don't even bother listening to him. So they're not getting the full story. I listen to all the news, ABC, NBC, CNN. I listen to every source I can so that I can come up with a good, well-grounded opinion on what's going on and not be misled by the BS, right? So let me just, first of all, one of the big things was, well, this is only affecting the elderly and people with compromised immune system, which my father has congestive heart failure and diabetes. So his big thing is, well, I'm walking around and I ain't doing, and he doesn't wear a mask, and he doesn't have a problem. Well, see, me and my sister have multiple sclerosis. We do have compromised immune system. So he's trying to prove that there's nothing wrong with it. But the moment he walks in here and he has that coronavirus, he signs our death warrant. But just like Trump, he doesn't care. He doesn't think, and it's not because it's not that he doesn't care. He doesn't think he's wrong, but he is. And it's anyway, let me move on. Stop talking about my father. So one of the big things was it doesn't affect kids. Let's have a look at that real quick. Let's just get into it. I'm going to play a couple of videos here throughout this, so it's going to be a long one. So let's go on to this first thing.
Alarming numbers out of New York regarding kids and coronavirus. City health officials issued an alert overnight that 15 children have been hospitalized with a mysterious illness possibly tied to COVID-19, saying they suffered from persistent fevers along with rash, abdominal pain, vomiting, and diarrhea. Doctors say it's a very rare but serious syndrome in some kids who get sick. Severe inflammation affecting the heart and other organs that can send the body into a state of shock and cause organ failure.
This new shock syndrome is really a very small tip of a larger iceberg.
12-year-old Juliet Daly had severe stomach pain and was airlifted to the hospital. She was diagnosed with COVID-19, which doctors believe triggered cardiac arrest.
I felt like things were breaking apart really quickly and that everything was terrible.
Juliet is now expected to make a full recovery.
Take this pandemic seriously and make sure you continue to social distance. We almost lost her.
These new cases making headlines as parents and leaders grapple with questions about when children should go back to school. By and large, kids have been largely spared from coronavirus.
In fact, if you look at the history of what we've seen, children do very well.
But there have, of course, been deaths, including the 5-month-old daughter of a New York firefighter. Her daughter, Jose Prosper, calling his daughter, Natalie, a warrior princess for her fighting spirit. Now, a new study by the National Institutes of Health hopes for the first time to give us a clearer picture of how coronavirus is impacting kids here in the U.S.
We'd all like to know why children don't get as sick with the virus. Obviously, it's very fortunate that they don't. But it's fascinating that they don't, because it's quite unusual for respiratory viruses to spare young children like this.
Dr. Tina Hardert is leading the study, which will focus on 6,000 people from 2,000 American families. Every 2 weeks, kids and some of their relatives will get a nasal swab to see if they have COVID-19 and if it's being passed on to others.
Do they transmit infection as effectively as we see, certainly in adult populations? And that's definitely going to contribute to us having knowledge about whether we should reopen schools, summer camps, let children visit with their grandparents.
Doctors say most children with coronavirus are either asymptomatic or have very minor symptoms. Because of that, many don't get tested, so we really don't know the infection rate among kids. This new federal study hopes to try and answer that. The study should last about 6 months.
Here's the problem, people. We don't know enough about what is going on with the coronavirus and kids. For one, we're just now finding out that it's causing severe heart problems with some kids. Like the lady said, that they're a little confused as to why kids are affected so differently by the coronavirus, because it's unusual for a respiratory illness to avoid kids. So we know that there's many things, many aspects of this virus that are unusual, that have never been seen before. It's not acting normal like other viruses of the type. That alone should tell us we need to back up and give it some more time. See if we can figure out what is really going on with this. How's it affecting kids, really? Are kids, they don't even know if kids pass it on when they're asymptomatic. Are kids just walking carriers? Are kids being affected in ways that we won't even know for years to come? You know, are our kids all going to start dying, dropping like flies in a couple of years because of the coronavirus? We don't know any of that. These are all answers that we need, or questions we need to have the answers to before we go saying, hey, just open up America again. Look, I know that we can't keep America closed. Everybody knows that. But for us to open it prematurely could cripple the United States beyond repair if this turns into something that nobody, and quite probably will, turn into something that nobody could have expected. I mean, hopefully About the time everything starts opening up, the numbers will start to drop and maybe it'll get under control and this new vaccine that they're screwing around with will actually work. You know, in a perfect world, that would be the best scenario. But what if it isn't? What if it doesn't? You know, those of you watching, if you're one of those who thinks we should open up and doesn't believe it, there's a real big problem. What if it's your brother or sister or son or daughter that is the next to die because we're not quarantining in place or whatever they're calling it in the state you happen to be in, and people are starting to get out again, and that is why they caught it. I mean, how are you going to feel? I'll tell you, this is what will happen. The people who were walking the picket line are going to come out and they're going to have a family member die, and they're going to be angry because there's going to be some blame involved. I never would have done that had I known X. And that's what it's going to be. Well, the reason they don't know X is because really none of them are really paying attention to what's going on. I don't know everything about Corona. What I do know is that there are too many unanswered questions. It's very virulent. It spreads rapidly. It kills a lot of people. Do you realize that I looked at it last week before I ended up having to go to the hospital for a few days and get some surgery because I broke my arm. Before I did that, I actually looked up online what the leading cause of death in the United States was. The leading cause of death in the United States, as we all know, is heart disease. Number 2 is the coronavirus. And maybe by now the coronavirus has overtaken heart disease as the leading cause of death in the United States. If not, certainly in the next month it will. They're saying that the death rate's going to go up to 3,000 a day. But before I keep going, let me move on to the next video because there's a lot of stuff to cover here.
The city is now alerting parents to an inflammatory disease affecting children that is possibly linked to COVID-19. This all comes after the News 4 I-team first reported there were several cases of this right here in our area. 15 children have been hospitalized in the city, and of those, 4 have tested positive for COVID. 6 others had antibodies. News 4 government affairs reporter Melissa Russo joining us from the newsroom. Melissa, with the city's new battle plan to keep kids safe.
Natalie, Mayor de Blasio admitting today that they were a little slow to realize this new wave. Now they're trying to catch up so they can track the scope. How are these children presenting? What is their COVID status? And really look at the bigger picture as pediatricians compare notes on the front lines as to what's working. Some of these children are very sick.
If you're a parent, I want you to listen carefully in particular.
Mayor Bill de Blasio and his top health officials today warning parents about a rare but serious new sickness emerging in children.
You have a parachute?
Previously healthy children, like 8-year-old Jaden Hardawar of Queens, who after some mild symptoms went into cardiac arrest.
Jaden has never had any health issues before. He born as a very strong kid.
I'm in bed with him watching TV. And then I heard him call for mommy. He looked over at his face and I saw his lips are all blue at that point.
The new warning from City Hall comes a week after the I-team told the mayor and health commissioner that this was happening to multiple children in our area. They were unaware.
We have not seen this to date.
So I want to thank Melissa Russo, who raised an important issue about a problem we're starting to see, and we take it very seriously.
It's been a terrifying experience for Jaden's parents and dozens of other parents who have watched their children become critically ill after initially believing that children would not be seriously impacted by COVID-19.
Fauci, he tells us how safe it is, that children are not affected. So there's something that we never worry about.
The I-team was first to report cases like this at Mount Sinai, NYU Langone, Montefiore, and Cohen Children's Hospital, where pediatricians and parents told the I-team they didn't understand why if pediatricians are talking about this.
They are critically ill.
They just had fevers for 5 days, often have GI symptoms.
Why aren't the health departments talking about it?
Yeah. Melissa, Jim, do you know?
Today, we also tried asking Governor Andrew Cuomo why his team has not been putting out any alerts on this front.
This is something that Dr. Zucker has been looking into, and Melissa has been sharing her reporting with me directly, and we'll have something on that tomorrow.
And we're now finding out that tomorrow, all New York State hospitals with pediatric critical care units will have to fill out this. It's a new weekly state survey asking for a lot of detail about each and every child presenting with this syndrome. It's due tomorrow morning at 9 a.m., which is why state officials may be able to tell us more about the big picture of how this is playing out in New York State. We have not been getting a lot of details from the state thus far, though we have been asking. Chuck?
All right, Melissa, it is quite disturbing. Thank you.
So that's more the same, but it's a little bit different take. They were several hours apart. That's why I played both of them. That was the majority is 11 out of the 15 cases that they've identified. That's the majority of these cases with the kids they had all contracted coronavirus at one point, and it was either active or they had it in the past. Now what that tells me, I'm not a doctor, but what it tells me is that this thing, even though they didn't get sick with it and they have the antibodies, so they're not actively sick with it, they're not symptomatic in any way, they've basically got it and gotten over it, it still affected their body. And it affected their body in an unusual way. So if it's affecting their bodies in unusual ways, how many ways is it affecting everybody that we haven't even figured out yet? They have not properly profiled this virus to know what it can do to the human body. They're trying to play catch up right now. And because everybody is pushing for this, reopen everything, we're going to lose our homes. And as I understand it, nobody's going to lose their home. They put a moratorium on all of that. So nobody's in fear of losing their home. You know, basically everybody is trying to work together to get through this. Now that we're separating out into these political factions of wanting to get back to work and open this up, that's all going to change, because nobody's going to be working with anybody anymore, because they're going to say it's back to business as usual. You know, you're not making your car payment, we're going to come and get your car. You're not paying your rent, you're out. You know, these things are going to happen. And I don't care who you are, after 2 months of not being able to work properly or your regular job, whatever, all of us are in trouble, except for the rich. The rich are the only ones who don't have anything to worry about. So they are the only ones that are benefiting, really, to be quite frank, from this. Everybody else you're either scared and you need to go back to work in an attempt to get caught up, which probably won't happen. Or you're rich and you're not worried about it, but you will be able to suddenly stop being cooperative and just start taking things from people, in my opinion. So let's move on to this next one.
John Heilman, the White House coronavirus task force seems to be disbanded. We will not be subject to those end of day 2-hour performances anymore until, I guess, Donald Trump gets too bored and decides to go out there and try something else on television.
Yeah, Lawrence, and I think I appreciated your opening to the show tonight. It was grim, and I think appropriately grim, given where we are and given the kind of extraordinary back-to-back nature of the last 2 days, where we learn about, on one side, projections and models and forecasts within the administration that suggest that May and June could be extraordinarily ugly in the United States when it comes to coronavirus. And the very next day, the White House announces that it's shutting down the coronavirus task force. I agree with you. I think the task force and its public relations orientation has been close to useless in terms of actually getting anything done. And yet, on the political side, to see Donald Trump at this moment having what can only be described as a mission accomplished moment, if that is in fact where we're going, shutting down this coronavirus task force and basically saying what he's now saying, which is, a lot of people are going to get hurt. Some of them are going to get hurt really badly going forward, but we must reopen this economy. The economy is key to him politically. And at this point, he seems to be essentially saying, I don't really care about public health to the extent I ever cared about it. We're moving on from that. We're into a new phase. And I think it's extraordinarily dangerous, obviously, for the country, but also I think extraordinarily reckless politically for the president if his hope is to get reelected.
John, I think one of the last numbers that Donald Trump himself, in his own imaginary projections, offered in the White House briefing room was 50,000. He was saying that he thought they might actually hold total American deaths to 50,000. Is it just that Donald Trump doesn't want to go into that room anymore when the numbers are going up and up, and his administration has some projections that indicate that the death rate could be doubling in the month of June, and they could be announcing 3,000 per day?
Yes, I think Lawrence, we've talked about various strategies or tactics that President Trump has tried in the course of 2020 with respect to COVID-19. The first was downplaying, then we had blame shifting, and now, more recently, we've been in the moment of goalpost shifting, where that 50,000 projection that he gave that one day in the White House we actually got to 50,000 that week. There was like a Monday that he said that he thought it might only be 50,000 deaths, and we actually crossed over the 50,000 threshold within 4 days of when he said that. And I think we've now seen him ratchet that goalpost, push that goalpost further and further down the field. It's now apparently he's setting 100,000 as the marker. But I think even Donald Trump, who never tires of mendacity, never tires of lying, never tires of innumerateness, I think even Donald Trump, and never tires of goalpost shifting, I think his arms are getting a little tired. And he's starting to realize that it's getting to the point where even by his standards, it's too ludicrous to continue with this effort. And it's not only ludicrous, but politically counterproductive.
Dr. Jarrah, let me get your reaction to the apparent closing down of the White House task force. They will continue to do their work behind closed doors. Is it going to matter that they don't have that public display every day?
So, Lawrence, I agree with you that a lot of what was shared in those 2-hour-long events was not very useful. But some of it was, and especially when Dr. Fauci spoke and Dr. Birx spoke. That was useful information. And the signal to the country of, we're not doing that anymore, I think is really harmful. And the way I've described this is, we are, to use a baseball analogy, we are, kind of in the second or third inning of a baseball game. And what it feels like is the manager has decided just to leave. And that's a problem. We need our manager to get us through the game.
Yeah, let me have a look at that, because I think that was premature, actually, was it? I don't think it's going to tell me what time it was, because it's not staying in place. None of those people are continuing to work because Trump is disbanding it altogether. And the only thing I can think of is that this is all companies do this when they face an issue with a product, right? Out of sight, out of mind. Keep people from talking about it, change everyone's attention to something else, and people will forget about it. The problem is that when people are dying by the thousands, that's not going to happen. But this is Trump's intention. This is what he's trying to do. And like I said in the beginning, because those staunch Trump supporters don't pay attention to anyone except for him and the Fox News, if they're not talking about all of the people dying, you're literally going to have people like my father who are going to be saying that there aren't that many people dying anymore. That's under control now, even though there's really thousands and thousands and thousands of people dying. They're not going to believe it. They're going to say, well, that's bullshit. That's not really what's happening out there. What news are you watching? They're not going to believe it because that's the way these people are. But Trump is not just stopping the briefings. He's disbanding it altogether.
We want to start with the information that you aren't getting now and won't soon get about the pandemic. Multiple reports tonight once again showed this administration's attempt to resist lawful oversight and its contempt for whistleblowers and independent inspector generals. First, regarding the coronavirus task force, it appears the president wants to end it. They're talking about ending the task force in the middle of the pandemic. The cases are still rising. They rose by at least 1,938 today, in fact, but they want to dissolve the task force. The president confirmed it while on a trip to a mask-making factory in Arizona today. The vice president says this should happen around Memorial Day, which is 20 days from now. Asked why he would end the task force now, this is how the president responded.
With the doctors saying that there might be a recurrence of coronavirus in the fall, can you just explain why is now the time to wind down that task force?
Well, because we can't keep our country closed for the next 5 years. You know, you could say there might be a recurrence, and there might be, and, you know, most doctors or some doctors say that it will happen, and it'll be a flame, and we're going to put the flame out. We've learned a lot.
So just keeping them honest here, no one has said close the country for 5 years. That's just a complete exaggeration. The president is admitting the crisis is not going away, but he is certainly trying to downplay the potential risk, saying it'll be a flame and that they've learned a lot and they can just quickly put it out. Why end the task force, though? The hub of the federal response. Yes, the president embarrassed himself in the country when he last took questions with the task force, suggesting injecting disinfectant into people. And yes, he lied about saying that, but that's no reason to stop having the task force and its scientists brief the public. It seems like they don't want their fingerprints on this. It seems like the federal government, the administration, is trying to pass the buck, pass the responsibility onto the states, onto mayors, onto governors, to anyone other than themselves, so that they won't take the blame come election time. So that's one story tonight, where the White House is closing down the one place you can sort of rely on from the government for reliable information, at least from the scientists, from Dr. Fauci and Dr. Birx. We mentioned there were multiple political angles that we're covering tonight. The other comes in the form of a whistleblower lawsuit, which alleges a former top health official in Health and Human Services was fired. The lawsuit alleges that Richard Bright's early warnings about the virus were mostly ignored. Also, that he was removed because he fought against the use of an anti-malarial drug, one that a VA study has since shown increases the likelihood of death and has no benefits. Incidentally, at Fox's town hall on Sunday, President Trump still insists the drug has saved lives, again, in the middle of a pandemic. Bright's lawsuit also says he was pressured to give federal money to a pharmaceutical buddy of the president's son-in-law, Jared Kushner. There's no allegation that Kushner knew about this alleged pressure. But the Washington Post is reporting that his shadow task force, the one that will continue to operate even as the official White House one closes shop, the one with the scientists on it, has dropped the ball on procuring medical supplies, largely because he's promoted his friends and associates, many of whom have no experience. And these breaking stories are all taking place as new modeling projects deaths will almost double because we are beginning to reopen the country. Also, as he's preventing officials like Dr. Anthony Fauci from testifying before Democratic-led committees in the House. Again, the recurring theme here is that any information that's unfavorable to the president's re-election campaign is on lockdown tonight, which is not surprising coming from a president who once said this.
Dr. Fauci said earlier this week that the lag in testing was, in fact, a failing. Do you take responsibility for that? And when can you guarantee that every single American who needs a test will be able to have a test? What's the date of that?
Yeah, no, I don't take responsibility at all.
Joining me now with more on all this is CNN's White House correspondent, Caitlin Collins. So, Caitlin, what more are you learning about this decision to essentially do away with the coronavirus task force?
Well, this is something they've been weighing for several weeks now. And if you look at the schedule, actually, about all the meetings that they've been having, they've started cutting them back because it used to be daily that they would have these meetings, Anderson, that would sometimes last an hour and a half, if not longer than that. And now they've started having fewer of them. You're starting to see the vice president get on the road more. Of course, he's the one often leading those. The president himself is also trying to get on the road more, even though he's not often at these meetings. And so the question is going to be if the president is going to form some other kind of task force to take its place. We know with the economics task force that the president constructed to help reopen the country, it was really large. It hasn't really met in any kind of capacity like you've seen this task force meet. And so the vice president is now confirming that it could wind down by the end of this month, by early June, even though that seemed to be a surprise to even some members of the own coronavirus task force who didn't seem aware that it would be winding down just that quickly.
And is it clear to you what exactly this means? I mean, assuming Dr. Fauci, is he still going to be then controlled by the vice president's office or the White House, or, the president's not wanting, the White House isn't wanting him to testify on Capitol Hill in front of House committees, I guess because there's Democrats on them, or they're controlled by Democrats. Does that mean then the CDC can hold press conferences every day talking about the latest scientific information, or the NIH can do that?
Well, that'll be the question if they do that, and really what this looks like, because the CDC has not held a briefing since March. Of course, we know the CDC officials sometimes anger the president with their pretty blunt warnings to the public. But also the question is, one of the reasons before the president admitted today that it was about politics of why Dr. Fauci couldn't go testify in front of the Democratic-led House, but he could go in front of the Republican-led Senate, is they said that Dr. Fauci was too busy to be going up to Capitol Hill and testifying. And so they said that there is this policy where none of the officials on the task force can go testify on Capitol Hill for the month of May unless Mark Meadows, the chief of staff, grants his approval. So the question is, does that change after May and they're no longer having these briefings, or does the White House continue to make that argument about their schedules? But also, I wonder what this will look like, because Dr. Birx is someone, she has an office inside the West Wing. So is her office space going to remain? Those kinds of questions, because often you've seen, if you're relying on the White House spokespeople or the president himself for information, it's often very different than what you get from the actual professionals who are looking at this data on a daily basis.
Yeah, and it's interesting that they're concerned about, Dr. Birx's time and Dr. Fauci's time, when they had no problem having Dr. Birx or Dr. Fauci sit there sometimes for, more than an hour as the president mused about whatever came into his mind and, tried to grab the spotlight of the very coronavirus task force. They had no problem with the doctors, the scientists sitting, waiting for the president to finish so that they could actually present factual information to the American people. The whistleblower complaint from Rick Bright, the president said he didn't know the guy. How damning is it for the White House? And again, these are allegations that haven't been proven.
No, they're only allegations. We should note that HHS has been pretty buttoned up about this because they know, obviously, it's leading to an investigation that he has filed a request for tonight. And we should note we are going to hear from him in person next Thursday, according to his attorneys, because they say he's going to be testifying on Capitol Hill. So he may go into these allegations more. But also looking at this, initially we know that in his statement he said he believed he was removed from his job because of retaliation, because he wouldn't grant express approval to drugs that the president had pushed. But if you read through this really lengthy complaint that he filed, Anderson, he also talks about the fact that he says he raised concerns back in January with top officials like the HHS Secretary Alex Azar about coronavirus, saying that he thought, he was concerned it could already be in the United States. He said that was something that was greeted with skepticism. And also those officials, he said, the top officials, Azar and another, Bob Kadlec, were confidently saying they believed they could keep coronavirus out of the U.S. Of course, that has not happened. So a lot of questions are also going to be about what his interactions were with other officials and whether or not that slowed down the administration's response even more overall to the coronavirus.
Yeah. Caitlin Collins, appreciate it. Thanks, Caitlin. Joining us now is Juliette Kayyem, CNN national security analyst and former U.S. Assistant Secretary for Homeland Security, also Chief Political Correspondent Dana Bash and Chief Medical Correspondent Dr. Sanjay Gupta. So Sanjay, the talk of disbanding the task force, obviously, on the face of it, it seems surprising given this is an ongoing pandemic that will continue through the summer and very likely, for until there's a vaccine or until enough people have become infected that there's a change in the spread of this. What do you make of the idea of closing this down?
Well, I think it's a bad idea. I hope that the work is still going on, even if there's not these briefings and an actual task force. You remember there was, back in 2014, there was an Ebola czar, and there was this idea that you need to create this whole of government sort of approach for something like this, and I think that's still necessary. But I think, subjectively, Anderson, there's this sense, that the coronavirus task force is being disbanded, states are reopening. I think a lot of people, it sends the message that this is over. You know, we've gotten through this, and it's very much the wrong message. You know, Anderson, I was just looking up on March 16th when they first announced the pause. There were some 4,500 people who'd been confirmed to have the infection, and some 70 people who had died. And now, you know, you can see this. At the time they're thinking about disbanding this task force, the deaths have gone up 1,000-fold, which is just startling, and obviously the rate of infection. So how do you create it when you had those numbers and disband it when the numbers are what they are and continue to go up?
Yeah. Trump created the task force when there was a fraction of the threat that we have now. But now he's disbanding it and basically thinks it's all over with. And it might pop up again like a little flame and we'll just snuff it out. Well, my question is, if it's that easy to snuff out, why didn't you already do it? If you're just going to snuff it out if it comes up again, which it hasn't gone away yet, so I don't see how I mean, it's just going to continue. It's not, it's going to get worse. That is not the little flame, unless he's talking about, well, this is the status quo now, and a little flame is if we get an increase, you know. If it's that easy to extinguish as Trump wants to make everyone believe, then it would already be done. And my opinion is that out of sight, out of mind, he's trying to get reelected. He's also trying to watch out for his buddies, his rich buddies, his own investments. And the reason that they don't really care is because of this.
Right now, Vice President Mike Clint, let me try that again. Vice President Mike Pence is touring the Mayo Clinic in Rochester, Minnesota, speaking with healthcare workers, plasma donors, and to see a coronavirus testing lab. But the video is also causing a stir because, as you can see, what's missing? He's not wearing a mask. Everyone else is. The Mayo Clinic's policy is for everyone in the facility to wear a mask, and the hospital noted on their Twitter account that the vice president was made aware of the policy prior to his arrival today. So let's go back to our CNN senior medical correspondent Elizabeth Cohen. And Elizabeth, where's his mask?
I don't get it, Brooke. This is really very, very striking. Why is everyone else wearing a mask and he isn't? He is a living, breathing human being like everybody else. He could get other people sick. Even if he's feeling fine, it is possible that he has coronavirus. That's been really one of the horrific things about coronavirus, is that people can have it and be able to spread it and not feel sick at all. That is why the CDC in early April changed their policy. They said the CDC recommends wearing cloth face coverings in public settings where other social distancing measures are difficult to maintain. It is critical to emphasize also that maintaining 6 feet social distancing remains important to spreading the slow of the virus. So the CDC says 2 things: wear a mask out in public settings like these and keep 6 feet away, and he's doing neither. I can't understand why he would do that. Why, is he scared of wearing a mask because he's scared that it would send out some kind of message? I mean, I'm perplexed. I can't understand why he would be doing this, and it, in fact, is really potentially putting other people in danger.
Impossible to crawl into his head and understand. Maybe he's thinking of the vice president. I want everyone to see my full face, but is that irresponsible, especially given their policy? I'm sure we'll learn more as the story progresses. Elizabeth Cohen, thank you very much for that.
A lot of people are wondering, what's the deal with the Book of Mormon?
Actually, that was the wrong video. I thought it was. It's not the video I thought it was. So, I mean, that's the precursor to the video that I thought it was. Let me see if it happens to be in here. I think it might be this one. Let's see.
Pence arrived in Rochester this morning, where he toured the world-renowned Mayo Clinic. Vice President saw the clinic's testing and plasma treatments and then took part in a...
No, that's not it. Let me just give me a second, folks. If you've seen it, it's the one where he actually says out of his own mouth, I get tested every day, and so does everybody around me. so I'm not worried about having the COVID-19. That is exactly what the problem is. Rich people know that they don't have to worry about it. And they know that the people who do have to worry about it, the people who will be affected, are all the people, all of the poor people who don't matter.
Vice President Mike Pence with an explanation that doesn't add up as to why
Here we
he
go.
didn't wear a mask when visiting coronavirus patients at the Mayo Clinic. You can see the vice president here. He is the only one, to state the obvious, who is not wearing a mask, even though that is the policy of the Mayo Clinic, which says it shared that policy with the vice president's office, and that when asked why he didn't wear one, well, here's what the vice president said.
Since I don't have the coronavirus, I thought it'd be a good opportunity for me to be here, to be able to speak to these researchers, these incredible healthcare personnel, and look them in the eye and say thank you.
All right, here's the thing. It's not about whether he has the virus or not. He's tested regularly. He doesn't have the virus. It's also not about looking a healthcare professional in the eye, because obviously you still can if you're wearing a mask. It's not a burqa. It's about setting an example. Instead of ignoring the rules that officials are asking people to follow. Out front now, Dana Bash, chief political correspondent, and Dr. Jonathan Reiner, a CNN medical analyst who also advised the White House medical team under President George W. Bush. So, Dr. Reiner, let me start with you. As a doctor here, and also given the role that you had advising a White House, what's your reaction to the Vice President of the United States being the only one to ignore the formal policy of the Mayo Clinic, which had been conveyed to his office, and not wearing a mask?
Wow, so wrong. So tone deaf. Look, first of all, on one level, this is just another in a series of mixed messages that we've gotten from this White House about this crisis. On the one hand, we tell the public that we want you to wear a mask when you go out in public, and now the vice president, shows up out of all places, a hospital, and refuses to wear a mask. We saw today that JetBlue is now going to require all passengers to wear a mask. But yet the Vice President of the United States, again, goes to a hospital and doesn't wear a mask. I was in late last night for an emergency procedure, and then again early this morning, and every second in the hospital I wore a mask. Most of the time when I wasn't even in the presence of a patient. And I wore the mask, and we wear the mask every time we're in the hospital, all the time we're in the hospital, to protect our colleagues. So when we tell when we tell the community to wear a mask, we're telling them to protect their neighbors, the old lady that lives next door, the man down the street. You wear a mask to protect the community. We want that message to be perpetuated by the president and the vice president, yet they refuse to do so. They refuse to set an example. I think it's disgraceful.
Dana, to the point that Dr. Reiner is making, the vice president didn't wear the mask today. President Trump, of course, has said he's not going to wear one. His messaging has been confusing, to say the least. Here he is.
No, I just don't want to wear one myself. Somehow sitting in the Oval Office behind that beautiful Resolute desk, the great Resolute desk, I think wearing a face mask as I greet
what an ass.
Prime ministers, dictators, kings, queens. I don't know. Somehow, I don't see it for myself.
I mean, it's almost like saying, Dana, he's too important to wear one. And then today, the vice president, whether he realized that, although he certainly should have, was sending the same message. And what does that tell people across the country that they should be doing?
Well, as Dr. Reiner was saying, it's one thing to not wear a mask in the Oval Office or at the White House. A lot of people aren't wearing masks who are tested and out and about, who we see at the White House. It's not just the president. But it's a completely different thing when a senior official, one of the most senior officials, particularly the head of the task force, goes to a hospital in order to get out a message about the work that the hospital is doing. And I can tell you there's frustration inside the vice president's office now, because they understand full well that everything that they wanted to do to highlight the work that the Mayo Clinic is doing is getting swept under the rug or overshadowed by the fact that he made a mistake and he should have worn a mask because of the guidelines of his own CDC, because of the rules of the Mayo Clinic, and as both of you have said, just common sense when it comes to optics and leadership. I think that despite the vice president,
he was thumbing his nose at what they were doing.
Of the mistake is setting in as we speak.
And Dr. Reiner, Pence said this to reporters when they asked why he didn't wear a mask. Here's his response.
As Vice President of the United States, I'm tested for the coronavirus on a regular basis, and everyone who is around me is tested for the coronavirus.
Yep.
And obviously, Dr. Reiner, that's a good thing, but it's really beside the point, isn't it?
It's beside the point. First of all, his test is only valid at the moment he's tested, and he comes into contact with a lot of people. So while he may have been a negative when he was tested at whatever point during the week, he wasn't tested as he was walking into the Mayo Clinic. But on the other hand, look, the vice president wouldn't disrespect the synagogue and not wear a skull cap when he walked into a temple, or he wouldn't refuse to remove his shoes when he walked into a mosque. You know, hospitals are our new holy places, and he's completely disrespecting the sacrifice that the nurses and the docs and the staff in hospitals make by not wearing a mask. What is he saying to them?
I mean, Dan, I guess that really is the question. And also, it was an opportunity to explain to people about when they should wear a mask, that when you're outside, if you're out alone or not in a social distance with someone, you don't necessarily need to wear it. But he was obviously very close with people and in a hospital environment. That's the opportunity to show people that's when you wear the mask.
Yeah, I mean, this is obviously a very different situation I'm about to tell you about. But I was with the vice president at the DMZ between North and South Korea 3 years ago. And he was incredibly attuned to the optics of what it's going to look like. So given, whether he was behind the glass or outside, all of that. So given that and knowing him and knowing that he understands optics and what that means, imagery, what that means for leadership and how it's perceived, it is surprising that he, no matter what his staff said, no matter what the hospital said, didn't get that intuitively when he looked around and saw everybody else wearing a mask. It was surprising.
Yeah, I mean, just on a human level, everyone else is wearing one and you're not. That's just basic psychology. You feel awkward. You notice you are not like the others. All right. Well, thank you both very much.
All right. So, to my point, the point I made in my last editorial on is Trump a moron or is it an evil agenda? That was just proof that it's probably an evil agenda on some level. Because these people think they're above everything because they have the resources at their disposal to be tested constantly, to have everybody around them tested constantly. So they don't have anything to worry about. So as long as they can make the world go back to normal for them, they don't really care what happens to everybody else. They don't care that the 90% of the country cannot do what they do, cannot be tested and cannot be around people they know have been tested. All it's going to take is, say, when this country's opened back up, for somebody, to come up who's infected with corona, and let's say, one of those guys who used to wash windows in the city, to come up and touch the president or vice president's car infected with corona. Then the Secret Service agent gets it. Then, next thing you know, the president and the vice president are both, dying of corona. That's what it's going to take before they take it seriously. And even then, their rich buddies are going to say, wow, it's too bad. Trump, he was a good man. He was doing a good job for us. And he got that coronavirus. But, at least we're going now. We'll have to get somebody else in there to do a good job. That's what it's all about, people. That's money makes the world go around. And in this day, I mean, here's the other thing that kills me. Everyone is like, well, it wasn't as big a deal. And we've had, up until now, just as many people die of the flu every year, which that is not the case anymore. But that has been the excuse. Yeah, but when we have the flu, it takes a lot longer for that many people to die. And do you realize the entire world had to shut down to keep the death toll as low as it is? And I'm saying this in general terms, obviously, not every single, square mile of the world shut down, because we've had people that didn't. But generally speaking, the entire world had to shut down. The entire world had to put themselves in quarantine for a long time, for months, to keep the death toll as low as it was. What do you think would have happened if we didn't do that? Where do you think the death toll? As a matter of fact, comment below. Where do you think the death toll would be today if the world didn't shut down? If things kept going as normal? Where do you think the infection, the number of infected would be, and the number of dead would be today if we hadn't have done that? Because there are still infected people out there. We still have more people infected every day now. What that means is that it's still out there. It's still out there and actively being transmitted. So when you open stuff back up while that's still going on, it's going to start all over again, people. And since the country has not been able to get a good foothold on this virus and a good profile of what it's doing and a good start on a vaccine, it's going to be a major setback when this thing all of a sudden starts going through the roof again. And there's going to be other countries who are going to start, shutting us off because we're idiots. We do not shut it down until it's under control. And then we open back up, and now everyone, nobody's going to want us coming to their country. Anyway, I just wanted to, get this out there. There's a lot of things happening right now that just aren't right. We should not be opening back up yet. And I know that nobody wants to hear that. But the alternative is that we open back up for, say, 3 or 4 weeks. And all of a sudden we have to shut back down again because we've had 3 times as many people die, and it's going to be worse. It's going to be much worse. So anyway, until the next time, y'all take it easy.